Child abuse is defined as physical, emotional, verbal, or sexual harm to a child. Physical abuse is more prevalent of the abuses. Physical abuse is any bodily harm to a child that isn't an accident. Examples are kicking, burning, hitting, and tying a child down. Children get bruises and cuts all the time, so how can we tell if they are being physically abused? When wondering if a child is being physically abused, look at the bruises he or she is getting. Do the bruises look like hands or something a child shouldn't get hurt with, like a belt or a bat? Also look at the location of the bruises. Most bruises are found on the inner thigh, rear, and some even on the face, like black eyes. Also, change in a child's behavior. At school, the performance, maybe alertness, watching for something bad to happen. Maybe they are acting out. They are leaving home early, going home late, not wanting to go home. Or maybe just being scared when approached by an adult. When seeing these signs, a child could be in danger and it should be reported. It is said that a child abuse is reported every 10 seconds. With the decline in child abuse, there's still a lot of children dying. Most children who die from physical abuse are under the age of 3. If they don't die, they might develop what is called shaken baby syndrome. Shaken baby syndrome is a serious brain injury caused by shaking a baby. This is a syndrome that destroys the child's brain cells and limits the oxygen getting to the child's brain. With this damage to the brain, the child is going to have problems growing up or may even die before 18. Children act out as it is. So if you are in an abusive relationship and you're a child, it's harder for you just to know what's normal, how you should act, because you need that attention. You need someone to do something about this abusive person that's in your life. So when you are being abused as a child, you need a lot more treatment to try to get you to a place of trust where you can trust adults again.
Psychotherapy is defined as a treatment with a licensed therapist to underline any mental, behavioral, sociological, or cognitive issue that is causing distress in a client's life. Therapy has been around for many eras, and like many things, it has evolved with time. There are many forms of therapies that can help for the appropriate situation. The most effective therapies when working with physically abused children can range from play therapy, art therapy, trauma-focused cognitive behavioral therapy, and massage therapy. Play therapy allows the child to feel at ease when talking about a traumatic experience, allows creative form of expression, and brings innocence back from the tragic situation. Similar to play therapy is art therapy. Art therapy uses visual arts to display the mental process of the child to improve emotional well-being. In regards to post-traumatic stress disorder, an evidence-based treatment by the name of trauma-focused cognitive behavioral therapy is well known in the psychological field. Trauma-focused cognitive behavioral therapy, also known as TFCBT, attributes fundamentals from cognitive therapy, behavioral therapy, and family therapy. Cognitive therapy focuses on changing the negative thoughts, actions, or attitudes by verbally problem-solving the issue that is causing other unwanted symptoms such as anxiety, depression, or post-traumatic stress disorder. Similar to cognitive therapy, behavioral therapy also takes on a communicative approach between a licensed therapist and distressed client. This therapy accentuates on behavioral health problems that may be created by the child's physical abuse. Physical therapy will allow the child to open up about fears, worries, or any form of distress. Family therapy, however, is a conjoined therapy with the abused child and the parent. The caregiver and child can express their emotions towards each other or the situation in hopes to mend the relationship. Family therapy benefits the child's safety needs, provides for constructive form of behavioral punishment, allows forgiveness to the abused child, and most importantly, it reduces the risk of future physical abuse towards the defenseless child. The abused child not only needs to reconnect with their mental emotions, but also with their body. When a child's body is violated, the child starts to disconnect their body in order to cope with the gruesome physical pain. Experiencing physical sensation or bringing awareness to a specific place of their body can be overwhelming when the feelings are reminiscent of the past events that were inappropriate, invasive, painful, or arousing. In order to cope with this post-traumatic stress disorder, the child can receive massage therapy, which focuses on gentle touches that brings the abused child back to their physical sense of safety and connection.
Experts estimate that 1 in 10 children are sexually abused before their 18th birthday. Youth are 2.5 times more likely to be raped than adults, and about 35% of victims are 11 years old or younger. 9% of 10 to 17-year-olds receive a sexual request while on the internet. 30% of children are abused by family members. As many as 60% are abused by people the family trusts. Nearly 40% are abused by older and larger children. Over 90% of children who are commercially sexually exploited have a history of child sexual abuse. Some behaviors you may see in children after being sexually abused include things like having a sudden change in eating habits, like refusing to eat, losing appetite, or having trouble swallowing. They also may experience things like mood swings, such as rage, fear, insecurity, or withdrawal. Children also may show signs of sexual abuse by writing, drawing, playing, or dreaming of sexual or frightening things. They also may not want to talk about a shared secret with an adult. Physical signs of sexual abuse include things like wetting and soiling accidents unrelated to toilet training, persistent and recurring pain during urination and bowel movements, pain, discoloration, bleeding or discharges in genitals, anus, or mouth. Roughly 15% of males and 30% of females have been victims of sexual abuse. This translates into 1 in 6 boys and 1 in 4 girls being sexually abused by age 18. According to the U.S. Department of Justice, 90% know their abuser. Of the 90%, 30% are family members and 60% are known to the child, but not family members. Approximately 30% of child sexual abuse cases are reported yearly, thus skewing statistics. Many experts agree that reports have increased over the years because professionals are more likely to take action. Due to increased awareness, there has been a 56% decline in physical abuse and a 62% decline in sexual abuse from 1992 to 2010. According to the Child Welfare Information Gateway, trauma-focused cognitive behavioral therapy is an evidence-based treatment approach shown to help children, adolescents, and their caregivers overcome trauma-related difficulties. There are many approaches to this kind of therapy, and it typically lasts 12 to 20 sessions. It is designed to reduce negative emotional and behavioral responses following child sexual abuse, domestic violence, traumatic loss, and other traumatic events. This type of therapy also helps parents who are not abusive to cope effectively with their own emotional distress through conjoint psychotherapy. Over 80% of children who receive trauma-focused cognitive behavioral therapy experience significant improvement after 12 to 16 weeks of treatment. Music therapy is another common way to help children who have been sexually abused. The therapist provides treatment including creating, singing, moving, and/or listening to the music. Music can provide a communication outlet for those who can't express themselves. Music is most likely to help with physical rehabilitation and facilitating movement. Because many children do not feel like they are in their own body, the movement helps them to reconnect with their physical being. Play therapy is also a common way to treat sexually abused children. It is a therapeutic method based on the understanding that play is the child's natural self-expression. Play expands the child's understanding of the world without serious risk. The 6 steps of play therapy are developmental assessment, obtaining a sexual abuse history, enhancing ego strengths, surfacing the trauma, working through and resolving issues. As traumatic as child abuse is, awareness is increasing and treatment is more available. Thus, rates of abuse are drastically declining.